Hey,
And your mic is muted, just so you know.
Okay, how's that now? Um, can you hear me now?
I'm on the board of directors of the Wisconsin Sleep Society. I'm certified in dental sleep medicine, and I'm delighted to be helping out in developing these training videos on the titration of mandibular advancement devices. So why do we need training videos on titrating oral devices? Isn't it sufficient just to control the snoring and they feel better and everybody's happy and the marriage is not on the rocks any longer? No, it's a little more than that. In 2015, these guidelines were published that said basically, hey, for mild to moderate obstructive sleep apnea, we see the outcomes are about the same for mild to moderate sleep apnea using an oral device or a CPAP. However, as part of the guidelines, they gave us the go ahead, but they also gave us some rules under which to practice because the evidence suggested we needed those guidelines.
It's gonna run me over again.
Showed a false and that and no showed a goal that was earth shaking to me and others that showed a false and negative of about 30% of people who report no snoring and no excessive fatigue, but still have quantifiable, measurable levels of obstructive sleep apnea. So this is very serious and very important. Okay, just a little bit of house cleaning. Terminology, MAD or mandibular advancement device is a frequently used term. Another frequently used term is OAT, oral airway therapy device. And I think this is a more appropriate term, OAT, because it implies that an oral device is going to help with sleep apnea, but it's not just through advancement, because stabilizing the airway requires both a Y and an X axis repositioning, which is the subject matter of much of this conference. So OAT is the term I most often use, and you'll see on many of the presentations. Today we'll be discussing the Herbst appliance, or the Herbst OAT. This appliance has been around for a long time and was developed for orthodontic patients. And it was first utilized in 1909 by Emil Herbst, a German orthodontist who was trained here in the States, but returned to Germany and did some work on development of an oral appliance to what's called jump the bite. And the Herbst appliance was developed. It's had numerous permutations over the years, and today it is the most popular oral airway therapy device available. I'm pretty certain I'm correct on that. And you'll see this oftentimes for titration in the lab for sleep patients. So I hope this is a very useful presentation. Okay, here is the side adjusting Herbst. And this has been the permutation, perhaps, that's persisted the longest, and that's typically what you'll see when a person comes in with a Herbst appliance. There have been changes and improvements, and this is a big improvement. You can see from the looks of that adjustment mechanism, the arm on the right there, that it's really become a lot more simplified, and it really, this permutation, so to speak, makes it ever so much easier for patients to adjust their appliance. And we do have those appliances adjusted by our patients under guidance. Whether you have a side adjusting Herbst or a rear adjusting Herbst, there are some things that are common to both. For example, that little tool right there is like a little Allen wrench, and it tightens up the little nuts or screws that hold the mechanism in place. And then you have that little wiggly thing there. That tool is what you'll use to actually make turns to that advancement mechanism on those side mechanisms when you're repositioning the jaw, advancing the jaw. Okay, more details on the Herbst appliance. There it is, zooming in at us. Okay, this is the tool, the Allen wrench type tightening device that will keep these nuts tight so this mechanism won't fall off. You won't have to deal with that, hopefully, in most cases. Okay, the arrows point to the little extensions. These are little metal extensions which will hold orthodontic type elastics that will keep the upper and lower members trays tethered together. And we want this to prevent mouth opening. We want obligate nasal breathers when they have these oral devices or CPAPs, anything. Pretty important. And hopefully patients will have their elastics connected to them. You won't have to deal with that. One thing, if the lower tray or the upper tray is pulled off the teeth because of the tension from the elastics, you're gonna have to probably take the elastics off. There is a way to tighten these appliances up. I'll show you in a second. These arrows show that, again, there are two trays that are independent of one another, and the lower one moves back and forth against the upper. Now, here is that internal clasp. This is a clasp embedded in the acrylic that can be tightened to keep these appliances from popping off the teeth. That's not an easy thing to do. If you have some needle nose pliers and you can kind of bend that towards the tooth on the inside, it's a little tricky. That would help, but I would just take the elastics off in that case and just proceed with the titration. Okay, this is likely the only tool you'll be using. It's just for adjusting, for advancing the lower jaw with the side adjusting Herbst. And this tool has changed, but there'll still be oodles and oodles and oodles of Herbst appliances out there with the older style of adjusting device. This is a little bit of a busy slide, but it's pretty simple. So we have to advance the mandible. You're in the middle. It's the middle of the night, and there you see the respiratory indices are creeping up. The apnea is not sufficiently controlled. So all you can do is bring that jaw forward, which will hopefully keep that tongue away from the back of the throat a little bit more, and that patient will breathe. So you insert the the adjustment tool in the direction of the, say, a little V, that little arrow, you insert it into the hole that, and you're going to turn in the direction of the V or the arrow, or towards the plus sign on that arm. And that tray will come forward. And you see that arrow that just showed up, you'll start to see this lengthening of that arm in that position with the side adjustment Herbst. We'll go over this again, but that's basically how to adjust the Herbst to bring it forward. In each turn, whatever you do on one side, you do on the other. It's very simple. You'll see. There'll be enough repetition. This won't be complicated to you.
I'm going to pause this if you can hear me. The animations are not keeping up with the audio. I don't quite understand why. This is not how the presentation should be. I'll finish playing this, but I'm going to fix this, and it's going to be published again for viewing when it's going to be when it's going to work better. So I apologize. I don't understand the problem, but I will fix it. So here we go.
Okay, a little more detail. So as you saw on the previous slide, there's a small plus sign. It's on each of the metal advancement arms. And you put the little key in there in the movable collar that rotates, the collet, and you turn the key in the direction of the plus sign, and that will advance it. So here's the plus sign, and there's the little tool, the advancement tool, that just completed a turn. And a turn is, again, 180 degrees, flat to flat, top to bottom, bottom to top. And you turn towards the direction of the plus sign. So that would be up to advance the lower jaw. You do the opposite to retrude or bring the jaw back. And here we go. Oh my gosh, this is the opposite, or the left side. And the tool is pointing down. And there's a plus sign there. And we've turned towards the plus sign. And on the opposite side, and again, advance the left side of the jaw, or the opposite side of the jaw, I should say, by the same increment as we did on the other side. I'm saying a lot of other sides here. Hope this is pretty clear. It's pretty simple. And again, we've got some little videos embedded here, and we'll show that. A little more detail. Each turn you make, regardless of left or right side, top to bottom, bottom to top, is 1/4 of a millimeter. And again, I would suggest you consider just keeping track of the number of turns and not the millimeters. But you might advance in any one titration session, you might advance a couple of millimeters. Okay, that's going to be minimum of 8 turns. If you need to go 3 or 4 millimeters or more, most of these can be adjusted for 5 to 7 millimeters. And as I'll deal with in a different slide, don't worry about causing jaw joint or TMJ damage. You are not going to do that. We're talking fractions of millimeters or a couple, 3 millimeters. You might flare up a muscle, a protruding muscle that's being cramped up by virtue of your advancement. Don't worry about it. If the patient has pain or soreness during or after the session, we'll deal with it. And the patient's been educated and apprised and he or she knows what to do to control muscle discomfort. But we'll get into that. But again, don't be too concerned. I've had a number of techs refuse to do it because they feel that they have liability for causing joint damage, et cetera, et cetera. Please, I got you covered there. Okay, I have got you covered, and I will help and deal with discomfort after this is done. Again, I said some repetition. So if we advanced 4 turns on one side and each is a 1/4 millimeter, we will have advanced a total of 1 millimeter. That would be a good night. That meant that we did our job well in anticipating what the ideal position of the mandible would be when we took our construction bite. But you'll often have to do more than 4 turns. Okay, on this Herbst, it's called a Respire Pink Herbst. The maximum advancement for it is 48 turns or 6 millimeters. I cannot imagine you'd have to advance that much to get to determine if the oral device is working sufficiently or not. To optimize it, something far less than 48 turns is typical. But if you find you've put 25 or 30 turns or you're approaching that number, don't worry about it. Just worry about respiratory indices and determining whether this appliance will be sufficient to control the apnea. That's all that matters here. Okay, and if they're real sore after the test, after the titration, have them turn back a certain specific number of turns, or you can do that before they go home, because we might use that final number of turns, but we might have them ease into it. We might have them advance it like a 1/2 millimeter a week for a couple months to get those muscles accustomed to being cramped up a little bit. The patients will know how to reverse that effect and be comfortable. But again, don't worry about the discomfort. We'll deal with it. Just get the titration done for me, okay? Thank you. And of course, what you do on one side, we will do on the other. And I said there'd be some repetition. So in an effort to keep you awake, I'll move on. Okay, details. This is the adjustment mechanism before any adjustments are made, any turns are made, and I'm pointing to where you'll start this. When you advancement, you'll start to see a space opened up between the connection hub, so to speak, and the collet, or that little collar. You'll see a space that opens up right there. You'll see that in the next slide. As promised, there it is. That's the space you'll start to see a space open up. That's at least a couple of, maybe 2 millimeters. That's probably at least 8 to 10 turns. Okay, that is a lot of adjustments. That's a lot of adjustments. If you've had to do that much, that's fine. I mean, we're looking at respiratory indices, not how much space there is. I don't care. I don't care if you have that thing out 6 millimeters. If you can tell me that this appliance was adequately adjusted and this is as much as the patient has to do with his or her apnea, everybody's going to be happy. If again during the night they're just their jaw discomfort is accelerating and they just can't get back to sleep, you're going to have to stop where you are and maybe turn it back a turn or two. And a turn or two doesn't sound like much, but that can be plenty when it comes to these muscles. It's mostly the lateral pterygoid muscle, but well, don't worry about that. But If you have to stop in the middle of the night because you're really getting it out there and the jaws are getting so sore they just can't fall back to sleep or stay asleep, then make the adjustments on both sides that you have to and just record that. And we will deal with that. And we might have some other tricks up our sleeve, so to speak, to improve the apnea reduction if you can't adjust anymore. And we'll talk about that shortly. Okay, more repetition yet. So a turn is typically 180 degrees, top to bottom, bottom to top. If the adjustment is something other than 180 degrees, that's fine. Just try to do the same on both sides. And if you look at the appliance when you start and you see the space on one side from the turns is different from the other side, I would adjust the shorter side and lengthen it to catch up with the side that's been adjusted more, unless the patient says it's not comfortable, in which case then I would start at the shorter opening here, excuse me. But it would make more sense to me to bring the shorter side up to the side that's open more and start your adjustments from there. And if it's not quite right, we can make those corrections afterwards. We just want to get that mandible advanced. But feel free to go ahead and equalize both sides before you get started. Okay, you can't mess up. Okay, I have a couple of videos, 3 videos actually, that just show it being adjusted. So here we are. There's the arrow, turning in the direction of the arrow, bottom to top. Okay, turn that little dude around. She just made a 1/4 millimeter turn. Now see the arrow, it's pointing down. Okay, put it in the hole, you'll find a hole. If you have to jiggle it to get the hole on top, that's fine. And turn it in the direction of the arrow or the plus sign. Okay, more repetition, adjusting these appliances, but I thought the more you can see of this, the better. So there we go. You can see she's looking for that hole. It's not quite sticking straight up, so she'll have to go back a little bit more and find it. But still, once she does, she makes the 180-degree turn, and it doesn't have to be exactly what you do on the opposite side, but again, you have to fiddle around for that little hole once in a while, but you'll find it. It's easy. So there we go. There's another turn in the direction of the arrow. Okay, find that hole. We're going to go bottom to top in the direction of the arrow, and if we look, we would probably see the plus sign up there somewhere, but we're not. Some of these older ones don't have it. I don't see a plus sign on here, do I? Nope, just follow the arrow. You're fine. All right, last bit of repetition, another video. Here we go. Beautiful. I like this because it was so easy to see. You can see the plus sign and the arrow. All right, there's the arrow. You see the plus sign. Well, you can see it. We're heading towards in the direction of the plus sign and the same direction the arrow is pointing. Yep, we get it. Make that turn now. Okay, find the hole. Here we go. Get it in there. All right, there. Painfully done there. Okay. Let's do another one. I think this really shows it well. Okay. So there we have it. That should suffice.
Advance it, and then out. And then you would want to do the same for the opposite side, but the arrow will be pointing the opposite direction, and so is the minus, and the plus will be going the opposite direction. So in this case, the minus is right there corresponding to the base of the arrow, and there's a plus right here corresponding to the tip of the arrow. So in this case, you'll find the hole closest to the base of the arrow, and then just advance it in the direction of the arrow and out. And one more time, and out.
Now the rear adjusting Herbst, same basic concept, an arm on each side, except that we're gonna put our key from the back side. More repetition, but I think it's important. So this is, we're just looking at the difference between the side adjusting and the rear adjusting. Yeah, we don't have that stuff anymore. We don't have the collar. We don't have a different tool. We, again, come into from the backside. Okay, we got a little handy dandy tool, and we put it the backside there, as you will see. Again, repetition, but you know, it can never be too much. There's the side adjusting tool for the Herbst, and there's the rear adjusting. It's this handle makes a big difference. Enables patients who might be manually a little challenged to adjust it. And in the middle of the night when you're tired, they have that little metal thing for the side adjusting Herbst that's a little more challenging than this. So it's a good thing. Okay, here's what I really like about this new and improved Herbst appliance, the rear adjusting. You cram it in the back. It's a counterclockwise turn, whether you're doing the right side or the left side. It's the same on each side. A one turn, 180-degree turn, bottom to top, or top to bottom. No, it's going to be bottom to top, counterclockwise every time. Very, very simple. And again, like I said, you should ask your referring doctors to provide these if you don't have any. You know, we try to make a point of that. And if you're really desperate, this is basically an Allen wrench. I'm not sure if it's metric or whatever, but you could find a replacement if necessary. But don't be afraid to ask referring doctors to help you get some of these tools. You're going to need them because patients forget. You know, and that's a lot of money just to waste on for poor planning for a titration study because the patient messed up, and they do. So, okay. Okay, another view from the top. Here it goes, and you're turning counterclockwise. Simple enough. Oh yes, another video. Here we go. Pretty self-explanatory. So there's the orifice. There's that creepy transparent hand. All right, do something with that. Get in there. Here we go. And make that turn. Here we go, counterclockwise. Again, whether it's right or left side, it's the same turn. And you'll start to see incrementally this expand. But you're not going to look at that. You just need to worry about turns, not millimeters, in my opinion. I just think it's more confusing. Just keep track of the turns, because this may have already been graduated or titrated a little bit. So if you don't know where you're starting from, it might be confusing. I would look to see if the left and right side are basically the same. They've been expanded pretty much the same. And again, make adjustments, get them equalized to the most titrated position on both sides, and then proceed with the sleep study. Despite the new design, the new mechanism, the new adjustment tool, the turns are the same. Okay, well, you've got your patient all set, and you're going to start your titration. You have the oral device. You're checking both sides to see that it's pretty much equal on both sides. This is your baseline view, and you see a 1 there, so it's been advanced 1 millimeter or 4 turns. Not so fast, mon ami. This is a little confusing. There's a 1 there, but you have 2 spaces. This is actually a 2 millimeter total advancement, or 8 turns. Okay,